1. A nurse prepares to administer insulin glargine. Which action is correct? A. Mix with regular insulin. B. Shake the vial before use. C. Administer subcutaneously at the same time daily. D. Give intravenously in emergencies. Correct answer, C. Rationale: insulin glargine is long-acting and should be given at the same time daily. It must not be mixed, shaken, or given for. 2. Which insulin has the fastest onset of action? A. Regular insulin. B. Insulin lispro. C. NPH insulin. D. Insulin glargine. Correct answer, B. Rationale: lispro is rapid-acting, onset 15 minutes, making it the fastest among the options. 3. A client is scheduled for breakfast at 8 a.m. When should regular insulin be administered? A. 7 a.m. B. 7:30 a.m. C. 8 a.m. D. 8:30 a.m. Correct answer, B. Rationale: regular insulin is given 30 minutes before meals due to its onset. 4. Which insulin can be given intravenously? A. NPH insulin. B. Insulin glargine. C. Regular insulin. D. Insulin detamir. Correct answer, C. Rationale: only regular insulin can be safely administered for. 5. A nurse mixes NPH and regular insulin. Which step is correct? A. Withdraw NPH before regular insulin. B. Inject air into NPH first. C. Mix both insulins in separate syringes. D. Shake the mixture. Correct answer, B. Rationale: air is injected into NPH first, but regular insulin is drawn up first, clear before cloudy. 6. Which symptom indicates hypoglycemia? A. Polyuria. B. Fruity breath. C. Sweating and tremors. D. Deep rapid breathing. Correct answer, C. Rationale: hypoglycemia causes adrenergic symptoms like sweating, tremors, and tachycardia. 7. Which insulin peaks and increases risk of hypoglycemia in the afternoon when given in the morning? A. Lispro. B. Regular. C. NPH. D. Glargine. Correct answer, C. Rationale: NPH peaks 4 to 12 hours after administration, often causing afternoon hypoglycemia. 8. A client is NPO before surgery. What should the nurse do regarding insulin? A. Hold all insulin. B. Give full dose of insulin. C. Consult provider for dose adjustment. D. Give only rapid-acting insulin. Correct answer, C. Rationale: insulin needs adjustment to prevent hypoglycemia, provider guidance is required. 9. Which insulin should never be mixed? A. Regular. B. Lispro. C. Glargine. D. NPH. Correct answer, C. Rationale: glargine must not be mixed due to its unique formulation. 10. What is the best site for fastest insulin absorption? A. Thigh. B. Arm. C. Abdomen. D. Buttocks. Correct answer, C. Rationale: the abdomen provides the most consistent and fastest absorption. 11. A patient develops lipodystrophy. What is the likely cause? A. Insulin overdose. B. Repeated injections at same site. C. Incorrect insulin type. D. Poor diet. Correct answer, B. Rationale: repeated injections in one area cause fat tissue changes. 12. Which insulin is considered basal insulin? A. Lispro. B. Regular. C. Glargine. D. Aspart. Correct answer, C. Rationale: Glargine provides long, steady basal coverage. 13. Which instruction is correct for insulin storage? A. Store opened insulin in freezer. B. Keep insulin in direct sunlight. C. Refrigerate unopened insulin. D. Discard insulin after 1 year. Correct answer, C. Rationale: unopened insulin should be refrigerated, freezing destroys it. 14. A client becomes unconscious from hypoglycemia. What is the priority intervention? A. Give oral glucose. B. Administer 4-dextrose. C. Provide insulin. D. Encourage fluids. Correct answer, B. Rationale: 4-dextrose is required for unconscious patients. 15. Which insulin has no peak? A. NPH. B. Regular. C. Glargine. D. Lispro. Correct answer, C. Rationale: Glargine provides a steady, peakless effect. 16. A nurse gives insulin and the patient refuses to eat. What is the priority action? A. Document refusal. B. Monitor for hypoglycemia. C. Give another insulin dose. D. Discharge patient. Correct answer, B. Rationale: risk of hypoglycemia is high if food is not consumed. 17. Which insulin is cloudy? A. Lispro. B. Regular. C. NPH. D. Glargine. Correct answer, C. Rationale: NPH is intermediate acting and appears cloudy. 18. What is the onset of rapid-acting insulin? A. 15 minutes. B. 30 minutes. C. 1 hour. D. 2 hours. Correct answer, A. Rationale: rapid-acting insulin begins working in 15 minutes. 19. Which condition increases insulin requirements? A. Infection. B. Exercise. C. Skipping meals. D. Vomiting. Correct answer, A. Rationale: stress and infection increase insulin needs. 20. Which is a sign of hyperglycemia? A. Sweating. B. Shakiness. C. Polyuria. D. Confusion. Correct answer, C. Rationale: hyperglycemia leads to excessive urination. 21. Which insulin is appropriate for use in an insulin pump? A. NPH. B. Glargine. C. Lispro. D. Detamir. Correct answer, C. Rationale: rapid-acting insulin, Lispro, is used in pumps for precise control. 22. A patient takes insulin Detamir. What is its primary action? A. Rapid glucose control. B. Basal glucose control. C. Mealtime glucose control. D. Emergency glucose lowering. Correct answer, B. Rationale: Detamir is long-acting and provides basal insulin coverage. 23. What is the priority before administering insulin? A. Check blood pressure. B. Assess blood glucose level. C. Monitor temperature. D. Check respiratory rate. Correct answer, B. Rationale: blood glucose must be checked to determine correct insulin dosing. 24. Which action prevents insulin dosing errors? A. Administer quickly. B. Double-check dose with another nurse. C. Use any syringe available. D. Estimate the dose. Correct answer, B. Rationale: insulin is a high-alert medication requiring verification. 25. A nurse notes a patient has confusion and sweating. What is the first action? A. Check blood glucose. B. Give insulin. C. Call the doctor. D. Start 4 fluids. Correct answer, A. Rationale: symptoms suggest hypoglycemia, confirm with glucose check first. 26. Which insulin duration lasts about 24 hours? A. Lispro. B. Regular. C. NPH. D. Glargine. Correct answer, D. Rationale: Glargine provides 24-hour basal coverage. 27. Which factor increases risk of hypoglycemia? A. Infection. B. Skipping meals. C. Stress. D. Illness. Correct answer, B. Rationale: lack of food with insulin leads to hypoglycemia. 28. A client is exercising more than usual. What should the nurse anticipate? A. Increased insulin need. B. Decreased insulin need. C. No change. D. Insulin resistance. Correct answer, B. Rationale: exercise lowers blood glucose, reducing insulin requirements. 29. Which instruction is correct for mixing insulin? A. Cloudy before clear. B. Clear before cloudy. C. Mix vigorously. D. Do not mix any insulin. Correct answer, B. Rationale: regular, clear, insulin is drawn before NPH, cloudy. 30. What is the best action if insulin appears clumped? A. Shake vigorously. B. Use immediately. C. Discard insulin. D. Warm it. Correct answer, C. Rationale: clumped insulin indicates it is expired or damaged. 31. Which insulin is short-acting? A. Lispro. B. Regular. C. NPH. D. Glargine. Correct answer, B. Rationale: regular insulin is short-acting. 32. A nurse gives rapid-acting insulin. What must follow? A. Exercise. B. Immediate meal. C. Sleep. D. 4 fluids. Correct answer, B. Rationale: rapid insulin requires immediate food intake to prevent hypoglycemia. 33. Which symptom is most severe in hypoglycemia? A. Hunger. B. Sweating. C. Seizures. D. Tremors. Correct answer, C. Rationale: severe hypoglycemia can lead to seizures and coma. 34. Which site has the slowest insulin absorption? A. Abdomen. B. Arm. C. Thigh. D. Buttocks. Correct answer, D. Rationale: buttocks have the slow. 35. Which insulin is used for diabetic ketoacidosis, DKA? A. Glargine. B. Lispro. C. Regular. D. NPH. Correct answer, C. Rationale: for regular insulin is used in DKA management. 36. Which lab value indicates need for insulin? A. Blood glucose 60 mg per deciliter. B. Blood glucose 250 mg per deciliter. C. Blood glucose 90 mg per deciliter. D. Blood glucose 70 mg per deciliter. Correct answer, B. Rationale: hyperglycemia requires insulin therapy. 37. Which is a common side effect of insulin therapy? A. Hypertension. B. Hypoglycemia. C. Hypernatremia. D. Tachypnea. Correct answer, B. Rationale: the most common complication is hypoglycemia. 38. A patient is sweating and confused. Blood glucose is 50 mg per deciliter. What should the nurse give? A. Insulin. B. Orange juice. C. Water. D. Protein meal. Correct answer, B. Rationale, fast-acting carbohydrates treat hypoglycemia. 39. What is the 15 to 15 rule? A. 15 units insulin every 15 hours. B. 15 g carbs, recheck in 15 minutes. C. 15 milliliters insulin dose. D. 15 minutes exercise. Correct answer, B. Rationale, standard hypoglycemia treatment protocol. 40. Which insulin is intermediate acting? A. Lispro. B. Regular. C. NPH. D. Glargine. Correct answer, C. Rationale, NPH is intermediate acting. 41. Which hormone opposes insulin action? A. Insulin. B. Glucagon. C. Estrogen. D. Thyroxine. Correct answer, B. Rationale, glucagon raises blood glucose. 42. Which situation requires holding insulin? A. Blood glucose 300 mg per deciliter. B. Patient NPO with low glucose. C. Patient eating meal. D. Hyperglycemia. Correct answer, B. Rationale, risk of hypoglycemia if patient is NPO and glucose is low. 43. What is the purpose of basal insulin? A. Control post-meal glucose. B. Maintain fasting glucose levels. C. Treat emergencies. D. Replace glucagon. Correct answer, B. Rationale, basal insulin controls glucose between meals. 44. Which insulin is clear? A. NPH. B. Lispro. C. Both B and regular. D. Glargine only. Correct answer, C. Rationale, Lispro and regular insulin are clear. 45. Which complication occurs from repeated insulin injections in one area? A. Edema. B. Lipodystrophy. C. Infection. D. Bruising. Correct answer, B. Rationale, fat tissue changes due to repeated injections. 46. Which action ensures proper insulin absorption? A. Inject into muscle. B. Rotate injection sites. C. Massage site vigorously. D. Use same site daily. Correct answer, B. Rationale, rotation prevents tissue damage and ensures absorption. 47. A nurse accidentally administers too much insulin. What is priority? A. Notify physician later. B. Monitor for hypoglycemia. C. Ignore if patient stable. D. Give more insulin. Correct answer, B. Rationale, immediate monitoring is essential to prevent complications. 48. Which insulin has duration of 3 to 6 hours? A. Lispro. B. Regular. C. NPH. D. Glargine. Correct answer, A. Rationale, rapid-acting insulin lasts about 3 to 6 hours. 49. What is the best time to check blood glucose for peak insulin effect, NPH? A. Immediately after injection. B. 1 hour later. C. 4 to 12 hours later. D. 24 hours later. Correct answer, C. Rationale, NPH peaks within 4 to 12 hours. 50. Which instruction is most important for a patient on insulin therapy? A. Skip meals if not hungry. B. Monitor blood glucose regularly. C. Avoid exercise. D. Double insulin if sugar is high. Correct answer, B. Rationale. Regular monitoring is essential for safe insulin management. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more content like this. Hit the notification bell so you never miss an update. See you in the next video.